there are many can either have a specific diagnosis, and it can include depression, anxiety, phobias, obsessive compulsive disorder, bipolar, and personality disorders. There are other minor mental health problems, but these are the major ones. Depression, of course, is the one that is affecting many people, and anxiety, phobias. So depression, anxiety can affect people, and it can even make them dysfunctional, make them not to be able to walk, not to be able to do what they're supposed to be doing. So it's that severe. So according to the research, there are around, in every 4 people, there is one that has a mental health problem. That's according to current research in Kenya. So when we define mental health, or when do we say someone is mentally okay or has good mental health? According to World Health Organization, is where an individual realizes their own potential, they can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to the community. So anything contrary to that, probably that someone has a mental problem, cannot do those things. So just a breakdown of that definition. When someone who has good well-being, good mental health, will be able to feel and express a range of emotions. And they're supposed to be happy, they're happy. And they can display appropriate emotions at a certain time. They feel engaged with work in general. They feel relatively confident with themselves and positive self-esteem. They can live and work productively. They can cope with stresses of life every day. They can adapt and manage any changes or uncertainties wherever they are. So mental health absence. So as we talk about mental problems, there are so many, and I know we have seen even where we are working, these are becoming the major cause of absence even at work. People are being given sick leave to a duration of about 3 months and all that. So mental health is a major thing, and it's having a huge impact in workplaces. It's having a huge impact in lives of people. So it's something that is of great concerns. There are millions of people who are millions of work days are being lost because of stress, because of anxiety, because of depression. So when we look at the law and mental health, it goes as much as the employers and are supposed to protect the physical health of their employees. They are also required to provide safety and protect the mental well-being of the employees. Employers have duties to assess the risk of stress-related poor mental health arising from work activities and take measures to control that risk. Where an employee is disabled, the employer must make a reasonable adjustment to support them in workplaces. And adjustment will vary depending on specific circumstances. So this one should be done to prevent and to minimize the impact that mental illness can have in workplaces. Stress and poor mental health at work is a common thing. Stress in itself is not a mental health problem, and everyone encounters stress. However, stress can contribute to poor mental health. So work-related stress is when there is adverse reaction that people have to excessive pressures or other types of demand that is placed on them at work can bring in that stress. And when there is repeated stress or there is persistent and constant stress, it can ultimately lead to poor mental health. Some of the things that can happen and can cause stress and poor mental health include demands in workplace, such as workload, work pattern, and work environment. There could be control. Someone has how much control someone has in the work that he's doing. Support, how much support is he getting from the employer, relationship, and the role. Whether the role is clear, whether the roles are clashing, and maybe someone is saying, I was supposed to do this, and someone is saying, I was supposed to do this, it can also bring in a lot of stress, it can cause poor mental health, and also change. Whenever there's a change in an organization, it's supposed to be communicated so that people can start adapting. Or otherwise, it can bring stress to people who are working in that place. So as I said, we are going to look at the major mental health problems, then probably look at how it affects people in a workplace. Look at how we can prevent them, how we can help those who are already suffering. So we shall look at depression and anxiety. However, there are others that we mentioned. They are bipolar. We have personality disorder. Personality disorders are very common. However, they are not people. You won't easily identify these people because their symptoms does not affect or does not impair with their functionality. Someone can still have a personality disorder, but they can still function. To the contrary, even those who have certain personality disorders can function more effectively. And people who say this someone is working hard, someone is workaholic. For example, people with obsessive compulsive personality disorders are people who can work excessively, they can be workaholic and all that. So people can look at it as an advantage. They might not identify it as a personality disorder. So these people are there, we work with them, we employ them, we interact with them, but we don't realize they have it. But illness like depression, anxiety, and others can impair functionality. Someone who is having severe depression will not be able to walk, will not be able to do daily duties, and all that. So it's good to know depression, identify symptoms, treat it earlier, or know how to prevent it so that people you work with or people even your family members will be able to identify and help them early so that they cannot get damages, they cannot get disabilities because of depression or anxiety or other illnesses. So how do you know if someone is working while depressed? How do you know how to deal with it? You can be working with someone. You can be working with someone and they are depressed. You can be staying with someone and they are depressed. So how do you identify them? What are the symptoms? Those are the things that we would like to look at it briefly. So depression in itself is a complex disease. And it can be driven by a combination of things, including medical, emotional, and genetic factors, as well as environmental, situational, and even seasonal issues. The workplace could be one of the factors because there are a lot of things that can be happening there, and it can really contribute to someone getting depression. So depression is very common, and some of the symptoms that one can present with may be physical, can be seen by someone, or they can be emotional, that can be felt only by the person suffering by with depression. So when they're still mild, they might not be easily recognized unless someone is keen enough to even see how someone is speaking, that to even identify how someone is doing things. Are they becoming more slow? Are they talking probably in a lower voice that they've been talking? So unless someone is very keen, they might not be able to identify someone who is having depression at early stages. But when it is already severe, you'll be able to notice because they already present with physical symptoms. They will be retarded physically. They are not moving. They just sit down. Their hands they're folding their hands. They have retardation generally, and probably they're not feeding. They're getting weight loss. They're becoming disturbed and confused. So that is when it's very severe. So it's good to know the earlier symptoms. Someone can just present with depressed mood. You look at someone is sad, and you are not. When you ask them, maybe they tell you there's nothing that I'm sad about. Or you look at their face, they're not expressing, they're not displaying emotion. Others are laughing, others are talking, but then they're just seated. or you notice they're speaking and moving slowly. You notice they're isolating. They don't want to, during tea breaks or during time when they're supposed to interact with other people, they're just isolating themselves. Those could be early signs of depression. So when it's identified earlier, it can be easily managed, other than when it goes beyond. So at work, you can identify someone with depression when they will miss work. They just call at home. They say, "I'm sick." They make excuses. They have trouble concentrating and can't focus on what they're supposed to do in the office, wherever they are. They miss deadlines when they are given something to do. They start having procrastination. They're just lethargic and they cannot achieve their goals. So they can also feel depressed, specifically when they are at work. This depression could be driven by job, serious workplace issues like harassment, having sexual harassment, physical harassment of any kind, and then discrimination by co-workers, abuse, and all that. So you could see them, they are just fatigued and they lack energy. So if you notice someone with these symptoms at work, it's probably that person could be having depression. It's good to ask them. You can help them. It's good to communicate with them how they are feeling and know, and may probably link them earlier to somewhere they can get help. So at workplace, how can we deal with this depression? Someone needs to acknowledge that they're depressed, especially when they've already known that they have these symptoms. At least maybe they've been attended to. Then they need to come to terms with it. We need to know whether it's a major depressive disorder or is it work-related, and are there issues that can be resolved? Are there stressors that can be resolved, and probably the condition will improve? And then they need to be linked to treatment. We need to encourage them to seek assistance, and then they need to follow treatment. And if they plan time away from it, especially if it's depression related to work issues, that could also help. They need to schedule breaks, set up work, plan a lunch break outside wherever they are, can also help improve the symptoms and prevent it from progressing. Self-care is also important, and any other small positive changes in their daily routines can also help. So depression, as I said, is a serious illness. If it's not managed, if it's not identified, it can cause a lot of impact, and it can even affect productivity, because someone will not be able to concentrate at work. They'll be procrastinating, they'll be absent from work, and maybe there are key people that they're supposed to do things. They will lack initiative, motivation to work. They'll be having no energy, they'll be fatigued, and then there will be also a decline in cognitive functions. They will not be able to solve and make appropriate decisions, solve problems, and they will have poor communication. So at the end of the day, productivity will be down, and it will really affect. So anxiety normally works with depression. Someone who is depressed can have anxiety as a comorbidity or as a disease that goes hand in hand. But you can also have anxiety just as a standalone disease, anxiety on its own. But it's also a very common disease that very many people are suffering from. Anxiety normally presents mostly with physical symptoms. Someone will have a lot of physical symptoms, and they will go to hospitals, they will seek help, they'll be told that the blood tests are normal, the imaging done is normal, all the screening tests done is normal, and ultimately someone will be diagnosed with anxiety. So anxiety is a mental illness that can cause someone who is depressed can have it, or it can just be alone. So, but it's normal to be anxious. It's also good. I know every one of us has experienced anxiousness. So there's that normal anxiety, and then there is pathological anxiety. It's normal to be anxious when you are anticipating an event. Maybe you will be doing something of sort, or you'll be doing an exam. You'll be anxious. And it's also that anxiety is good because it will help you to work to achieve what you want. And then after that, it will wear off. and it will just go because you have done what you want. But anxiety that persists beyond is not normal, and it impairs functionality, it impairs performance. So the feeling of anxiety and panic interfere with daily activities. That's when you have that pathological anxiety, it interferes with daily activities. The symptoms are difficult to control, they are out of proportion and actual danger, last a long time. You may avoid pleasant situation to prevent the feelings. Just to let you know, anxiety, as I've said, as physical symptoms. Someone can just have things like restlessness, they can have headache, they can have dizziness, they can have even vomiting, they can have diarrhea. There are a lot of physical symptoms. The reason is there are a lot of there are hormones that are secreted when someone is anxious that cause all over the body and hence bringing symptoms. Actually, symptoms can be head to toe. That's from the foot all the way to the head. You can have trembling of legs, hands, you can have pain in the stomach, chest discomfort. Someone is feeling just having a lot of distress, and they can have like they're feeling a lump in the throat, they can be dizzy, all that. So those are the physical symptoms of anxiety. But the hallmark will be, you need to ask that person, apart from these symptoms, do you feel excessively worried? Do you feel as if there is something do you feel apprehended? You feel something worse can happen anytime or you're going to die, things like that. Then they will tell you yes, then you know that someone is probably anxious. So in workplace, you can have anxiety as well, that involves feeling stressed, nervous, uneasy or tense about work, which could include anxiety about job performance, interaction with co-workers, or even public speaking. It can persist and impair performance. When we identify someone in a workplace who is having anxiety and they are not helped to deal with that anxiety, they will not be able to perform. So it can lead to a drop in performance. Someone even can miss work because they're having headache, they're having dizziness, and all that. They won't be able to come. They will not be able to engage at work, and then of course the frequent physical complaints that I've told you, and seeking help, seeking reassurance, going to hospitals, they're not getting satisfied. When they go to this doctor, they're told everything is normal, they want to go somewhere else. So it's a difficult thing to come to terms with unless someone gets appropriate help. So how can someone manage this at work? They need to adapt healthy habits, enough sleep, eating healthfully, regular exercise. You need to be organized, communicate, prepare and plan, set clear boundaries, clear toxic co-workers. Gossip and negativity in a place can bring a lot of anxiety because someone can give you false information about things. You start feeling something worse can happen. We're going to lose job. We're going to go home and things like that. And people start becoming anxious. You need to use your time and management skills well so that you don't become anticipate things, and if you don't do things well, you'll not be able to accomplish in time. And then you start becoming restless, becoming anxious, and all that. So there's good preparation, good planning, communication, and all that will prevent it. Of course, the employer can also educate the workforce and managers. Employers and workforce will need to be educated regarding mental health, like anxiety, and they need so that they can feel psychologically safe. There are EAPs, employee assistance programs in various institutions can also help them. They can be encouraged to seek help where there are counselors, where there are people. And then support managers in supporting employees with anxiety. Working with managers on strategies to manage with empathy and compassion will be very helpful, and it can compact and it can reduce chances of that. This is drug abuse is a wide topic. We might not talk about everything today, but it's a problem that is affecting almost everyone. Talk of people in schools, talk of people in workplaces, families having a lot of impact. So it's a huge topic. The people are abusing drugs. Drug addiction, also called substance use disorder, is a disease that affects a person's brains and behavior and can lead to inability to control the use of a legal or illegal drug or medicine. Someone will start small and then they will want to increase slowly because they are tolerating it and they want to feel the effects more and more. So then they get into addiction. So the drugs that are commonly abused are alcohol, as we know, cannabis, nicotine. So when someone is addicted, they will continue using those drugs despite even the harm they are getting. Someone will be having liver failure because of alcohol, but they will still want to continue using it because they are already addicted, and then they will die out of the substances. So employers and employees will suffer both of them if they have people who are abusing alcohol or abusing substances in workplaces. Because people who are using substance can even cause accidents that are occurring because of substance abuse. They cannot make the right judgments. They can also cost employers money and hurt them financially. These people can steal items. They can also miss work. They can do mismanagement. They might do things out of their judgment, and hence causing a lot of problems. And then to themselves, they'll be able to have poor work performance. They will be coding out all the day, every day, arriving work late, frequent change in workplaces. They will move from here to there. They will struggle with productivity. They will not be able to do and achieve what they're supposed to do. And then they will be filing work compensation and claims every now and then. Co-workers who frequently have accidents will exhibit erratic behavior, and these are just some of the ways that we can identify people who are using substance in places, even in workplaces. You will see them; they have erratic behavior. They can have dilated pupils, slurred speech, and all those signs. They can have extreme mood swings. They are just irritable. When you tell them they get irritated, they want to start a fight. They are paranoia. They have noticeable exhaustion, even during early morning. They have frequent absenteeism. Those could be signs. So drug testing and educational program can be helpful because you can use this to identify and then help those who are already using substance in various ways. So it will help reduce and prevent drug abuse in workplaces and providing such benefits as increased morale, decreased workplace accident, reduced employee theft, increased productivity, reduced employee turnover, and decreased cost of insurance because you will prevent them from getting medication every now and then. There could be, we could develop this in institutions, employee assistance program. This would be a good thing to help those who are using substance and even those who are suffering from mental problem. A quality employee assistance program should be made available to those who feel they may have a problem, as well as those who feel they are developing a problem. A quality program will offer services like counseling to deal with substance abuse and probably other mental health problems. These programs are put into action by familiarizing supervisors with procedures. Those people who are supervising units or departments and all that can be familiarized with the program. We ensure that supervising staff members are knowledgeable about drug abuse and they can understand signs and symptoms. Then you can develop the rules and spread to people. Supervisors will have a task to educate other staff members in their units and make them understand existing rules in an organization. We could link them to testing, counseling, and other treatment programs. Then we link them to mental health assessment to ensure they are fit to continue working and all that. So EAPs are good, we can develop them. And some of the educational programs that could be beneficial include Drug Awareness Day, written material about substance and substance abuse, videos, about substance abuse can also be helpful. So generally, when we, as managers, as supervisors, as head of institutions, we need to have well-being conversations to identify people who are suffering, to be able to identify people who are suffering from mental health problem earlier. So the conversation, the well-being conversation will focus on one-on-one workers' health and well-being, just to know how are they healthy, are they mentally okay, and it should be done regularly, and it should be an ongoing thing. Managers may wish to use some of the prompts and questions of well-being conversations, like asking your people, how are you feeling? I have noticed that maybe today you are lethargic, today you are weak. When you answer such a question, they'll be able to respond and maybe tell you how they are suffering. So you'll be able to help them earlier. Ask them, what support do you need? What do you need from me right now? They'll be able to tell you, I feel this and this, I need this and all that. They will open up and you might be able to identify problems. How are you finding current workload? They might reveal to you the stress they are having and the repeated stress that they are having every day in a workplace. What challenges are you dealing with? Then they can also be able to help it. So that should be an ongoing conversation. We'll be able to identify the problems that we mentioned, be able to identify someone who is depressed, someone who is anxious, someone who has any other mental health problems, or someone who is even suffering from addiction of a certain substance. These are recommendations for people's managers, people who are heading other people, supervisors, in terms of maintaining good mental health, probably for the workers, for the workforce that you're managing. You should be able to check in regularly with employees, and ideally face-to-face would be okay, weekly. And when you do that, you'll be able to do the conversation we mentioned earlier. You look for both signs and symptoms of poor mental health that we mentioned. Be able to tackle unhealthy working habits, raise concern about poor mental health with the employee, to actively review workloads, signpost to support services. Let them know where they can get support services and where they can get assistance. Prompt well-being opportunities, undertake well-being action plans, review your own management style, keep in regular contact, and review support where it is provided. That will help maintain and prevent mental health problems that can result from a working environment. More support, like first return to work, whenever the people are sick, changes to duties, time off for medical treatment will be allowed. Coaching and mentoring, more regular rest periods. When you're giving them off, let them be more regular, should be helpful for maintaining good mental health and additional management support. Change to start and finish times will also be good. Some of the programs that you can develop for employee wellness programs. These are the programs that can prevent people getting a mental problem, or it can even help those who are already developing mild symptoms get relief of those symptoms. Can be developed. These are just a few that I mentioned, but there can be many. We need to have financial education because we find out that even depression can be as a result of poor financial management of people, financial stress. People cannot pay for their daily needs. They cannot pay for school fees. They're looking at they have loans. They cannot finance. Then they go into stress. The stress persists. They get depressed. So every organization should have this financial education, educate people how they can manage. Give your people autonomy so that they can have at least they can think, they can do things, and then probably as long as it's going with the mission and vision that you have, given autonomy, work-life balance. the people should not be called on leave to come to work, because that's their time to rest, their time to have their time with family and other friends, and of course this will boost their mental health. So if there is an imbalance in work and life, someone is at work several hours, 7 days a week, 12 months in a year, that will probably bring in mental health issues. Someone will be depressed, they will not be able to come back to work when they are required, performance will drop down, and things would go, things will not go well. We need to celebrate employee success. That's very important, because this will boost their morale, will also boost their, to make them more happy, and they'll be more mentally okay. So when you celebrate them, you are making them good. You can have a shout out, for example, in a monthly newsletter. You can reward those who are doing well. Just celebrate success. Those who are celebrated will be happy. Those who are there also, they will celebrate with the rest. That they will also want to be celebrated. They will be working very hard, and this will really boost their mental health. You can have an on-site fitness and accommodation if it's possible, so that people can do things within, things that will enable the fitness. You can have collaborative workspaces where people work together, not in Zinco offices, but just collaborative. Or even if they cannot collaborate during work, you can collaborate people in some events. Bring people together, people from different departments interact and all that. This will also boost their mental health. We need to support community involvement. When someone helps someone, they feel good, and that will boost their mental health. So you should allow people to go to community, help people, and do things to the community. They will be able to feel good. These testing activities are also important. You should have even sporting activities, things that will distress, that will make people exercise. We have these programs. It will be helpful people, where people can just do things to distress themselves. Is good. So when we do all these things and provide a supportive workplace and workforce with good mental health, it will help build employees' loyalty, dedication, and engagement to perform well for the organization. And this will ultimately benefit everyone. Benefit the employer, benefit the employee as well. So these are just some of the screening tools, but I don't think they're feasible. But someone can just screen themselves for depression, for anxiety, even for substance, and know whether they are overusing the substance, they're already developing addiction, and probably seek help. Maybe we should provide these self-screening tools for ourselves and probably for the workforce whenever it's possible, so that they can just check in, because most of these are just questions where you just answer yes, no, and then you have a total score down there. You know whether you have anxiety, for example, and you know whether you have depression. There are others for substance and everything. So otherwise, thank you. That's just a brief presentation. They are varied, and there are very many mental health disorders, but we can't mention them all because there are very many, but some are even mild. They cannot affect someone. Someone can still function, can still do things and have that problem. But things like depression, anxiety, substance use, and even schizophrenia can really impact someone and impair functionality. Disability out of mental health problem is very huge. We have very many people who are disabled because mental health problems, as we know, affect the mind. So if it affects the mind, it will most probably affect the cognitive functions. That is the thinking, the concentration, the judgment, and all that. And someone will need that in order to function. So if you can't function, then you are mentally disabled and you will not be able to do all those things. Thank you.
All right, thank you very much. Thank you very much. I hope you can all hear me.
Yes, we can.
All right, thank you very much. So thank you very much. That was a great presentation. Thank you very much for the very great presentation. And I'm sure you have learned a lot about mental health. Even those of us who probably thought we are very healthy, we are realizing that there are so many categories of mental health. And specifically, even the tool you have provided was very helpful. I wish we could also get it, and then we can also share it to members so that members can also use it to just test themselves and find out, am I having mental health? Am I well? But you have given us a lot of insight on mental health and also tips on how we can become either for ourselves, become more mentally healthy, and also for organizations, how we can create those mentally healthy organizations. So we would like to leave this time now for questions. So if anyone has any question, please go ahead. We can take questions. And so if you have a question, I would like to request before we take questions.
Helen,
yes, please. Hello.
Yes. I have a colleague who was listening to this conversation, to this presentation. She's a psychologist, clinical psychologist at Ichape Mission Hospital. Maybe before we go to question and answer, she can have just a few minutes to add on something, just a request.
Yes.
Millicent,
all right.
I can hear.
Yeah, so thank you so much.
All right, thank you.
Yeah, so thank you so much, Kirui, and also the team. Very happy to be part of this discussion. I'm a clinical psychologist working at AIC Kijabe Hospital, and I am also excited to discuss and also to answer some of the questions as we deliberate on how to improve our employees' wellness and also your wellness as well, because I also interact a lot with HR personnel, and all the burden is also on you. So how do you maintain wellness when it comes to your mental health? I think for me, one of the things that I can also mention about is about toxic working environment. How do you ensure that you're able to prevent and also support your team members? Because also toxic working environment is a precursor for some of these mental conditions. So are you having 360 leadership evaluation so that you also get feedback from your employees who are able to give you constructive feedback about their employers, about their leaders? The other component, and also a question that I want to pose back to you, as a mental health practitioner, the reason why we are having a lot of challenges in management of mental health conditions is poor follow-up. So if you are supporting someone, how engaged are you? Are you having a follow-up plan? Are you engaging with their practitioner? For those who are probably having challenges with substance use, you need to have at least a return to work agreement with this other person, so that you're able not only to maybe identifying is one thing, but follow-up is the most important thing. And the minute you have loopholes in the follow-up, then it's going to be like a cycle. So have also request the professionals who you're engaging to give you to be more engaged in the care that is in agreement with the employee, so that you become part of the team that is following up on your staff members. Unlike diabetes and like hypertension, the biopsychosocial component, the social bit is very important in mental health, and we can't shy away. And if you're working in the HR department, this is a core component, the social support. So what is your role in the social support in ensuring that whoever is receiving mental health services is adhering to treatment? And I'm really focusing a lot on those who are attending, who are actually being followed up on substance use. And then some of you have insurance covers, and you know the best thing is prevention is better than cure. You can engage mental health practitioners the way you go for screening for diabetes, the way you normally go for screening for hypertension or for cervical cancer. It's the same thing. So when you're having, you can encourage your team members to frequently or on a yearly basis to have a check on their mental wellness. Thank you. I want to give back to the team for questions.
All right, thank you. Thank you very much, Millicent, for that very insightful information you've given us, especially about the toxic workplace and the 360 evaluation. So that we may be thinking this manager is nice to everyone, but kumbe they're nice. There are other people who feel, you know, differently. So that was very helpful. And even the social support that as HR we should be able to give to people so that we can be able to create that very conducive workplace. So thank you very much for those additions. So maybe now we'd like to leave this session open for question and answer. So if you have any question, and before we go to question and answer, I would like to request that those of us who feel that this was a very helpful session, maybe you could just give us a thumbs up, or you can clap your hands, so at least you can encourage the those who have presented. Kindly, if you feel that it was very helpful and you learned a lot, maybe can we give a thumbs up, please, to the presenter and also Millicent, if that's okay with everyone? Then we can all of us have a chance to engage. A thumbs up, please, if you feel it was great. And as we do the thumbs, thank you very much, Quinta. As we do the thumbs up, Alec has now to just leave it open for question and answer. So if you have any question, please put up your hand and then we can come to you. Yes, thank you. Anyone with a question, please? Thank you, Victor. Anyone with a question, please? The session is now open for question and answer. All right, I think there's somebody who had asked a question. Maybe I can just say it. Somebody was asking, in case somebody is diagnosed with the mental illness, do they have to take, for example, bipolar, or you talked about other schizophrenia, you know, do they have to take medication for life? Or is it a treatable condition? Because you said that there are mild disease, mental health illnesses and the others that are not mild. So I think somebody was asking that question. Maybe to you, Vincent and Millicent. Thank you.
Yes. So when someone is diagnosed with a mental problem, once we have identified specifically what kind of a mental problem is, we need to be put on medication. It's not necessarily long life, but it's good to say that most of our patients will be on long life treatment. Others will be on 2 years, 5 years, 6 months treatment, but this would depend on severity and the episodes that someone has. For example, if it's depression, if it's a multiple episodes, then someone will be on long life just to prevent a relapse, because they'll be okay when they're on drugs. But when you stop it, they have a relapse. So you will put someone on long life, but you can, so it's individualized and it depends on many factors. It also depends on whether someone is getting other supportive treatment like psychotherapy and social support that is good enough, and bringing them to a completion or full remission of symptoms, and that will shorten the duration of treatment. But if they have multiple episodes, then probably they will be on long life. And also it depends on the condition. Condition like schizophrenia, majority of people will be on long-time treatment, several years, long life. If it's depression, it can actually be managed even within 3 to 6 months. If it's just a first episode, and someone will be okay. If it's mild, moderate depression, they might not be even necessarily on drugs. We can just do psychotherapy, counseling, and someone will be able to recover. But if it's severe, then they need to be put on drugs, and for some time, then we see whether we can stop.
All right, thank you very much. So they need to be on drugs if it's severe. All right, thank you. I don't know whether Millicent, you have anything to add on that. If somebody has a mental illness, like bipolar or schizophrenia, or Kiri has already answered.
I think my team member has already answered that. But the other component I also want to emphasize is that mental health, it's a teamwork. So there's the bit of the psychologist as well as you receive the medication, because medication will play a bigger part, but at the same time, there's the behavioral component that is important. So having that comprehensive care then improves the prognosis of recovery and also can speed up the recovery. Thank you.
All right, thank you very much. I don't know whether you have any other question. If you have any question, we request you can unmute and ask, or you can always put up your hand and we'll come to you, or you can even chat. You can use the chat box and ask your question. Thank you.
Daktari?
Yes, please go ahead.
Yes, mine is just a comment, and really to thank Millicent and Vincent for this very nice presentation. We really appreciate the good work that Vincent have put into this, and very enlightening. I believe there are a lot of takeaways that individually or as a team we can actually go with and go and implement. So I really want to appreciate and encourage each one of us at least to pick one or two action points from this, and then we go and apply wherever we work. Otherwise, well done, and we're really happy for the engagement that we've had this evening. Asante.
All right, thank you very much. I think there's somebody also who made a comment. Niseta Mbogo said, we can never have enough of this. Mental health issues are so rampant. And those of us with over 1,000 plus employees as HRs, we have a responsibility to ensure that we are fully supporting our employees. So Health Month, South Rift, you have started on a high note. Well done. All right, thank you very much, Nestet. I believe we're picking up something that even in this Mental Health Month, I believe you're picking up something. I don't know whether anybody else has any question or any comments. You're welcome. Maybe as people get ready to ask, you talked about distressing activities. I don't know. I was trying to figure out which are some of these, especially in this day and age when we're talking about the economy being hard and people are really being laid off and all that. I don't know how, as HR, they can help organizations during these very difficult times. Even as you talk about distressing activities, are there any activities that may not necessarily involve money? Are there some distressing activities that maybe reachable to HRs, even if you're on a low budget? Maybe just ideas on that. Thank you.
Millicent?
Well, I think there's one thing that Tului mentioned about giving back. And giving back doesn't even mean you having money, like visiting and getting engaged in some certain activities, like a volunteer activity as a team. It's very refreshing. And also you can have your own me time, right? We call it mindfulness. Me time also is a bit relaxing for your team members so that they're able to focus on themselves as well. So maybe the next time when you call us, we can probably discuss and introduce some of these activities that people can do at their workplaces just to ease them up and also improve their mental wellness. But if you have time, you can read about mindfulness. It's not meditation, mindfulness. That's something that has been illustrated to be very therapeutic and also improves concentration and also improves your attention at your workplace as well.
All right, thank you very much. Mindfulness. I think those of us who are listening keenly, we have picked on that we can Google and find out more about how can we create more how can we have more of those mindfulness activities that can help us and even help improve our well-being, mental well-being. Thank you very much for that. And somebody has asked a question: how many episodes would need for you to say that now this to be a long term? Is it how many episodes would want it to have, so I can say now this is long term, so therefore this is a long term illness, or this is just a once off? I think somebody's asking that. Maybe back to you, Vince.
Okay, so the episode. Hello. So in mental health problems, actually, we normally don't talk about cure, but we talk about remission. So someone can present the first time, we call it the first episode. If you treat them and maybe you stop medication and they come again the second, that will be second episode or third episode. They can have a second episode while also on treatment. They were well on medication, but along the way, they have a relapse. So for episodes, if they are one or two, if it's the first episode, probably you would go for a shorter treatment. If it's the second episode, you might do even up to 5 years. If it's third episode and beyond, that is someone who you probably consider long life treatment, especially for bipolar and depression and schizophrenia as well. So if they have the third episode counting beyond there, then probably they'll be on a longer or even long life medication. But just to insist, it's individualized. We look at every patient and we look at a lot of factors. Even before we consider stopping treatment, we normally look at the social, do they have social support? Are they compliant to treatment? Do they have enough knowledge of the symptoms of their problem, of their disorder? If they have, and then we can consider stopping medication. So we look at each case individually, and then we now consider treatment. This is something that we normally discuss with our patient. We tell them that we think we are still giving you 1 year just to make sure you are stable and to make sure you are getting good support and all that. So it's individualized, but probably it depends on those factors.
All right, thank you very much.
And
Yeah, yes, please,
sorry, maybe I can just add on what Vincent has mentioned, that mental health conditions are so many. There are like 362 conditions, so they are very vast. And unfortunately, is it unfortunate or unfortunately? Unlike other conditions like diabetes, where you just have a click and then you check your random blood sugar and you can tell this person is diabetic. We check maybe your blood pressure and we tell you that you're hypertensive. For mental health, it requires also a bit of time for us to complete like a puzzle. So we pick symptoms here, pick the other symptoms, and then complete the puzzle. So even as we are going back, it's not weird for someone to be attended to 1 or 2 times and we still don't have a diagnosis, right? But the reason why also it takes a bit of time for the conclusive diagnosis to be made is also to help us in the management plan. And the management plan is also, as Vis has mentioned, is tagged on different components. There are certain conditions that for sure someone will be on treatment for a very long time, or even for a lifetime. There are others that are probably going to take short. But even if you look at a person who has been suffering from alcohol use, we call them recovering. You'll hear them talking about, I'm still recovering even after 30 years, meaning that there's a high predisposition or there are more risk of getting the same conditions if the triggers are not also managed well. Thank you.
All right, thank you very much for that. So what I'm hearing is the use need to identify the triggers and manage the triggers well. And now that you've talked about, sorry, I'm asking questions, maybe also people can have a chance to also write their questions. If they're not in a position to ask them directly, they can write them in the chat box. You talked about for those people who are abusing substance abuse, and maybe for some of us work in organizations where you have people who are abusing substances, specifically maybe alcohol and things like that. You talked about having a return to work agreements and follow-up. So what happens if the person does not stick to the program? I mean, as HR, can you continue keeping somebody? How long should you keep somebody who is, maybe you've taken them for rehab and they keep on having remissions? I mean, I'm just wondering how should HR handle it? Because on one end, you want to be supportive, but on the other end, if the person is not, they keep on still going back to the, just being alcoholic. I don't know what your advice is, because you talked about return to work agreements. And so I was just following up on that. Thank you.
Yes. So the first thing would be, of course, to provide supportive services. But if these people, you checked on the slides somewhere, I talked about developing the supportive programs. And in those supportive programs, we would even have rules that we keep keep our workforce rules about substance use. So they will know that these are the rules. In case this happens, this will happen. I will get this support. If it doesn't happen, then probably even it will reach a point where someone will be dismissed. So, but everything would have to be fair. They would have gotten at least some support, and then there are steps to be followed. If you identify to be using substance abuse, for example, one institution will say, we will take you to rehab. If you recover, that will be fine. You will continue working with us. We'll give you this time. But the second rule will be, if you don't recover, then probably we will give you a chance to go out and probably manage. So it depends on discussion, but all the rules should be fair and not to bring a lot of impact to the organization, at the same time not impairing the life of the employee. I think it's just a measure, just develop something that is fair. But I agree, there are circumstances where someone will be totally dysfunctional. They cannot do anything. You have given them 6 months, you have given them 1 year, and then also you need to replace. So that would be, it's good to be fair, develop something that would work for you and the employee. I don't know whether Millicent has something to add on that.
Yeah, that's a very good question. When I started working in the mental health world, I had thoughts that I would actually help every patient suffering from substance use recover, until reality hit home that not all patients will actually go to full remission, and also the relapse rates are pretty high. But at the same time, we still need to support our team members. But accountability also is of key importance. You can enable a condition by not being accountable. So please ensure that when you're supporting someone who is going through substance use, you sign a contract with them. And they have also emphasized that engage with the healthcare practitioners. Engage with the healthcare practitioners for accountability purposes, so that at the end of it all, if you are having to dismiss this person, then you also don't find yourself in the other side of the law, because you cannot stigmatize someone because of mental health condition. So just to safeguard yourself as well, it's important to be, from the word go, engage with the healthcare provider and also engage with the employee, so that you have a very clear treatment plan that you are actively engaged in. So that when it comes to determination, then it's not going to be complex for you as well from the legal perspective.
All right, thank you very much. That's a good point, so that we can also protect ourselves from legal suits. All right, thank you. And I think some comments have been, people have made some few comments. I can read them out that are very helpful. Alice says that having open communication with employees and creating awareness so that staff can provide support systems can also help to provide mental wellness. Thank you very much, Alice. Margaret says, I guess HR can help by having policies against discrimination, against those with mental conditions, right from appointments, recruitment, all the way to exit. And then Niceto also says that it's good. I think we must anchor it on our policies. I believe this was maybe also in regard to discrimination, maybe also with regards to maybe those people who are abusing drugs. How far can we support them? I don't know, but I believe also having policies on very much. It seems anyone I can pick randomly, or anybody can volunteer themselves. Maybe I can request CLA. Let me not pick up. I don't know if CLA is there. If you would like to give a vote of thanks to our very able.
Thank you. Okay, thank you, Daktari.
Panelists, and maybe just to mention it, we can never have enough of this. Yeah. So thank you.
Okay. I hope you can hear me,
yes,
Daktari.
Welcome.
Good. So yeah,
yes,
I think like you've rightly put it, we can really never have enough of this. It looks like it's a very exciting topic, and probably it needed more time. But the 1 hour or the 1.5 hours or so has really been very, very useful. We want to thank the facilitators. Vincent, thank you so much for agreeing to facilitate this session. Asante sana for the work that you've done, and also Millicent for jumping in and supporting Vincent in this. Thank you all the members. We really want to thank both from all those from South Rift and also from far and wide. We want to thank you for being available and supporting in this program. We're really happy as a branch. We are happy for joining us and listening in to this. So thanks also Daktari for the leadership and organizing this, and the entire leadership of the chapter. Asante sana. So we really look forward to even more of such. I believe there are other topics that are lined up in the coming days, and we want to encourage all of us to continue to support, to continue to work with the branch and to support. So otherwise, thanks so much. Let's keep being active. Let's keep being engaging with the rest of the members, and I believe we are really going to go far. Otherwise, asante sana. Right. Back to you, Daktari.
All right, thank you very much. I think there's something that Wycliffe has said. Wycliffe has said that if we manage mental state of the employees, all the rest will fall into place. And I think that is good in terms of helping us to close it. As HR, we need to create those very conducive workplaces. Millicent talked about toxic workplaces. So we need to make those opposite of toxic, create those very conducive workplaces or work environments that will ensure what Wycliffe has just said, that will ensure that the mental state of employees is well taken care of, so that we not really have to deal with some of these issues. Of course, some of the employees may also have come with mental illnesses, not only from the workplace, but from elsewhere. But we've also been educated on some of the ways that we can be able to provide that kind of supportive environment to ensure mental wellness. So it's not the employee health, the mental health month. There's also another forum that IHRM has lined up. So I'll also share it in the wall for the IHRM members, so that for the South Rift members, so that we can also plan to engage and also to listen more. And I'm sure we will also get to learn more. I think the more we hear something, the more also we learn and able to practice. But for now, thank you very much, members, for coming. We really appreciate all of you. And we're looking forward to seeing you in the other sessions that we have lined up in the coming months. Thank you, everybody, and have yourselves a good evening. And before we go, maybe Vincent, we would like to request if you can also share with us a tool so that we can always test ourselves.
Yes.
You talk about a self-test.
Yes, self-screening tools.
Yes.
Can you be able to share to your email or WhatsApp?
Yes. Oh, yes. I can share with the members. Yes, I think it will also help us keep ourselves in check and just have those activities that will always ensure that even as individuals, we are maintaining our own mental health. All right, thank you very much, everyone, and have yourselves a nice evening, and God bless you. Bye, everyone.
Bye.
All right, bye. Thank you.